This is Barry Zalma, Zalma on Insurance. I am an attorney who has retired from the practice of law and now spend my time as an insurance claims consultant and expert witness, an author and producer of these videos. Today, I'd like to talk about who got caught, because insurance fraud continues with vigor across the United States, and occasionally prosecutors, insurance investigators catch people who get caught and convicted of the crime of insurance fraud. For example, Peter Costas bribed dozens of people addicted to heroin and other drugs to enter rehab centers on the Red Bank, New Jersey, and his cronies could illegally soak up money for lucrative referrals. Costas worked with several marketing firms to recruit potential patients who had robust private health insurance from New Jersey and elsewhere. Costas paid up to several $1,000s each. Costas stayed in touch with the patients at the rehab facilities. He instructed them to stay long enough to generate referral payments. Sometimes he directed patients to different rehab facilities month after month to generate multiple referrals. The facilities paid the marketing firms $5,000 to $10,000 per patient referral, and about half went to Costas and the other body brokers. Costas received only 13 months in federal prison for his crime. Then thousands of healthy people, plus patients with diseases like Alzheimer's and dementia, were falsely told they had just 6 months to live so that they could be enrolled in Medicare hospice for $150 million of fraudulent billing. Rodney Mesquias ran a hospice chain called Merida Healthcare Group in Texas. In many cases, people were still walking, driving, and even coaching sports when Merida's marketers told them they were dying. Mesquias even sent chaplains to discuss last rites and prepare people for imminent death, while enrolling them at group homes, nursing homes, and housing projects. People were kept in hospice for years, lining the pockets of Mesquias and his conspirators. Sometimes Mesquias had doctors do emergency surgical procedures to keep hospice patients alive and the false bills flowing. Physicians also were paid kickbacks to qualify patients for hospice. Mesquias forged medical records to create the illusion that his patients were dying. He bought luxury cars, jewelry, clothing, real estate, season tickets for the San Antonio Spurs, and bottle service at Las Vegas nightclubs. He treated marketers to parties and tens of thousands of dollars worth of booze. Mesquias was prosecuted, convicted, and sentenced to 20 years in federal prison. Timothy Baxter, the former medical director of Indivior plc, was sentenced December 17, 2020 in federal court in Abingdon, Virginia, to 6 months of home detention, 100 hours of community service, and a $100,000 criminal fine in connection with the company's marketing of an opioid drug. Baxter pleaded guilty in August of 2020 to 1 count of misdemeanor information related to Indivior's false and misleading representations to the Massachusetts Medicare and Medicaid program regarding Suboxone, a drug approved for recovering opioid addicts to avoid or reduce withdrawal symptoms. Indivior's former CEO was sentenced in October 2020 and is thinking again about his criminal conduct. Dr. Moses DeGraff Johnson, a dual citizen of the United States and Ghana, pled guilty December 18, 2010, to committing healthcare fraud, conspiracy to commit healthcare fraud, and aggravated identity theft. Over the course of almost 4 years, beginning in late 2015 or early 2016 until his arrest in February of 2020, DeGraff Johnson did significant harm to hundreds of patients living in Tallahassee, Florida area. Many of these innocent victims underwent unnecessary and invasive surgical procedures, while others were victimized through medical records reflecting procedures he did not perform, erroneous and misleading records that could cause doctors in the future to determine a mistaken course of medical treatment for many patients. DeGraff Johnson, 46, owned and operated Thorvax PA, a Florida corporation doing business as Heart and Vascular Institute of North Florida. It was a physician's office and outpatient catheterization laboratory located in Tallahassee. As part of his plea, DeGraff Johnson acknowledged engaging in a wide-ranging and consistent pattern of performing 2 invasive diagnostic angiography procedures, one on each leg, on hundreds of his patients, whether medically indicated or not. When his patients returned for follow-up office visits, DeGraff Johnson submitted fraudulent claims to their insurance company stating he performed atherectomies during the appointments. Using this scheme, DeGraff Johnson admitted he falsely claimed to have performed over 3,000 of the surgical procedures to clear blockages in arteries, as many as 845 of his patients' legs. Having gone through that same surgery myself, it is not fun, and it is necessary if you truly have a blockage, as I did. DeGraff Johnson inappropriately gained access to his vulnerable victims by establishing relationships with churches, nursing homes, a hospital, and an outreach organization. The U.S. Attorney's Office is working to uncover all aspects of the methods he used to identify and exploit his former patients, many of them in underserved communities. Prosecutors are also pursuing information regarding the unnecessary medical procedures and falsified medical records so that the defendant's former patients may be properly informed regarding their true medical conditions and can secure appropriate treatment going forward. Hopefully, when he is finally sentenced, he will serve a long stay in the Gray Bar Hotel. Seashore Drugs, Incorporated, and its owner John D. Waggart and its pharmacist in charge Billy W. King II entered into a consent judgment and injunction in federal court in the Eastern District of North Carolina, requiring the pharmacy to pay $1,050,000 in civil penalties and to cease dispensing opioids or other controlled substances. Memorial Health Services, according to California Attorney General Xavier Becerra, reached a settlement with the state of California for payment of $31,532,679 after the health system self-disclosed that it overcharged Medi-Cal for a period of 3 years. The fact that the state didn't catch on until they confessed is something of great concern, because this service, this memorial health service, stole so many millions of dollars from the government. And they've agreed to pay back the $31 million, but one only must suspect that they probably collected a lot more. We will never know because of the consent judgment entered into by the government with the provider. Heidi Robertson, 35, was employed as the primary insurance biller at a Birmingham area psychology clinic that billed the Medicaid agency for counseling services that were never provided. Robertson was sentenced to serve 18 months in prison and ordered to pay $850,000 in restitution by U.S. District Judge R. David Proctor after she pleaded guilty earlier this year to one count of conspiracy to commit health care fraud. Capstone Medical Resources, the owner of the facility and former Birmingham psychologist Sharon D. Waltz, pleaded guilty in 2019 to defrauding Medicaid at least $1.5 million and is scheduled to be sentenced by Judge Proctor later in the year. An investigation was instituted by the Program Integrity Division of the Alabama Medicaid Agency after an audit showed that billings submitted by Capstone for counseling services had increased from $99,000 in 2015 to more than $2 million in 2017. A subsequent investigation was conducted by the Medicaid Fraud Unit and the U.S. Department of Health and Human Services of the Inspector General. This investigation determined that most claims submitted by Capstone from 2016 to 2018 were fraudulent. Robertson's role in the scheme included submitting claims using the Medicaid identifications of friends, family members, children for counseling services that never took place. Waltz paid Robertson a 10% commission for all claims paid. A Fitchburg woman pleaded guilty to Social Security, mass health, and food stamp fraud in Massachusetts. Rhonda Bernal, 62, pled guilty to 3 counts of theft of public funds and 2 counts of making false statements. The charges of theft of public funds provide for a sentence of up to 10 years in prison, 3 years of supervised release, and a fine of $250,000, or twice the gross gain, whichever is greater. The charges of making false statements provide for a sentence of up to 5 years in prison. Scotty Akers, M.D., an Eastern Kentucky doctor, was sentenced to prison for unlawfully distributing controlled substances. As part of the guilty plea, the defendants admitted using Facebook Messenger and other messaging applications to sell prescriptions for opioids. According to their plea agreements, Sarissa Akers exchanged prescriptions written by Scotty Akers for cash in parking lots. The defendants also admitted that Scotty Akers performed no physical examinations that would justify these parking lot prescriptions and failed to engage in other measures that prevent the abuse and diversion of opioids. Nabil Jabbour, 69, a physician who previously operated an addiction treatment practice out of offices in Greensburg and Collinsville, Pennsylvania, was sentenced to 12 months and 1 day in prison, followed by 1 year of supervised release. Jabbour was also ordered to pay $75,000 fine and a total of $40,000 in restitution to Medicare and the Pennsylvania Medicaid program. During his plea hearing, Jabbour admitted that on 3 occasions he unlawfully prescribed to undercover law enforcement officers buprenorphine, which is commonly used in the treatment of patients suffering from opioid addiction. Tara Dean, 46, a resident of Pittsburgh, was sentenced in federal court for conspiracy to defraud the Pennsylvania Medicaid program and health care fraud. United States District Judge Kathy Bisson sentenced Dean to 4 years of probation, including 6 months of home detention. Dean admitted that between 2011 and 2017, she was an employee of Moriarty Consultants, Inc., one of 4 related entities operating in the home health care industry. During that time, Dean admitted she participated in a wide-ranging conspiracy to defraud the Pennsylvania Medicaid program for the purpose of obtaining millions of dollars in illegal Medicaid payments. To date, 12 defendants, including Dean, have pleaded guilty for their roles in this conspiracy. Deandra Bankhead, the owner and operator of Elite Home Care, an Atlanta-based home health care provider, was sentenced for defrauding Medicaid out of nearly $1 million between September 2015 and April 2018. Bankhead submitted thousands of fraudulent claims for services that were never provided to medically fragile children under the Georgia Pediatric Program. According to the U.S. Attorney, the charges and other information presented in court, the geriatric program is an in-home nursing program designed to serve Medicaid-eligible children under the age of 21. Bankhead's scheme began in 2015 and continued until April 2018. Over that time, Elite Home Care submitted more than 5,400 claims, the vast majority of which were fraudulent and for which Elite received $1.2 million in reimbursement. Among the fraudulent claims that Bankhead submitted to Georgia Medicaid for services that were never performed were for services allegedly provided to an infant girl after she had passed away, and 3 children, all under the age of 13, who suffered from cerebral palsy or Down syndrome. These children were entirely dependent on others to complete the most basic tasks of life, feeding themselves, clothing themselves, bathing, and even standing up to walk. Bankhead was sentenced by U.S. District Judge Thomas W. Thrash, Jr. to 5 years and 3 months in federal prison and 3 years of supervised release, and ordered to pay $999,999 in restitution. On the other hand, outside of the medical business, a Boston man was sentenced in a multi-million-dollar scheme targeting Iowa insurers, where Ming Zun Zeng, a.k.a. Jason Zeng Kellerman, or Kellerman Jason Zeng, was sentenced by the United States District Court in Massachusetts after pleading guilty to 1 count of mail fraud and wire fraud. The sentence comes after Zeng pled guilty in February to a scheme in which he applied for over $11.5 million in life insurance and accidental death coverage on his deceased brother. Of course, his brother had died long before the policies were purchased. He will enjoy a long stay in the Gray Bar Hotel. If you found this video interesting or of use to you, recognize that it was adapted from Zalma's Insurance Fraud Letter, Volume 25, Issue Number 1, delivered and available on January 2, 2021. The newsletter is published twice a month and has been so published for 25 years, and will report about all types of insurance fraud and only convictions, never arrests. Thank you for your attention.